Hello friends, welcome to Agrim Medical Concepts. So friends, this is the second part of the NEET PG MCQs based on antimicrobial resistance. So here comes the first MCQ. Mechanism of resistance to penicillins via beta-lactamase is altered penicillin binding proteins, drug efflux, breaks drug structure, and alteration in 50S ribosome structure. So friends, here actually the option C is correct, that is breaks drug structure, because beta lactamases, for example penicillinase, breaks down the beta lactam ring of the drugs like penicillin. Therefore, the mechanism of resistance to penicillins via beta lactamase is breaking the drug structure. Actually, altered penicillin binding proteins cause resistance to methicillin. Development of efflux pumps is important method of drug resistance in tetracyclines, and alteration in 50S ribosome structure produces resistance to aminoglycosides. So the correct answer here is C, that is breaks drug structure. Okay, so now the next MCQ is: a child was admitted to the hospital with H. influenzae meningitis, and cefotaxime is preferred over ampicillin because cefotaxime has more oral bioavailability. Cefotaxime is more active against H. influenzae having altered penicillin binding proteins. Cefotaxime is cidal drug, whereas ampicillin is bacteriostatic. And the last option is cefotaxime is more active against beta lactamase producing strains. So well, actually resistance to most strains of H. influenzae occurs due to production of beta lactamases. Therefore, ampicillin, which was the drug of choice earlier, is now not effective in many patients. Now a third generation cephalosporin like cefotaxime or amoxicillin clavulanic acid combination is also active. So this combination is also preferred among beta lactam antibiotics. And also know that another highly effective drug for H. influenzae is azithromycin. Okay, so well, here the correct answer is D. Cefotaxime is more active against beta lactamase producing strains. Now the next question: combination of amoxicillin with clavulanic acid is active against all of the following organisms except MRSA, penicillinase producing Staph aureus, penicillinase producing Neisseria gonorrhoeae, beta lactamase producing E. coli. So friends, in the previous video also we have discussed that methicillin resistance occurs due to altered penicillin binding proteins, therefore cannot be reversed by beta lactamase inhibitors like clavulanic acid. So the answer here is A, MRSA. Number 50. Okay, the next question is: which of the following cephalosporins has maximum activity against MRSA? Ceftriaxone, ceftazidime, cefuroxime, and ceftobiprole. Answer here is D, ceftobiprole, because fifth generation cephalosporins, there is ceftobiprole and ceftaroline. So these are the only beta lactam antibiotics which are active against MRSA. And yes friends, definitely at the same time we should also discuss about certain very important points about these fifth generation cephalosporins. So well, know that fifth generation cephalosporins are also known as anti-MRSA cephalosporins. These cephalosporins had been introduced in 2013 for the first time, and ceftaroline by IV route is widely approved and used in the US, Europe and India. And so far as the ceftobiprole is concerned, it is given by IV route and this ceftobiprole is approved in some European countries but not approved in the US or India as of now. And these fifth generation cephalosporins cover a broad range of gram positive and gram negative bacteria, but coverage of anaerobic bacteria is limited. And however, this class has a unique anti-MRSA activity because they can bind to penicillin binding protein 2A. It is a mutated PBP that MRSA uses to resist beta lactams. And also know this MRSA can cause community acquired pneumonia CAP. There is pneumonia cases other than hospital acquired pneumonia or ventilator associated pneumonia, and this MRSA also causes ABSSSI, that is acute bacterial skin and skin structure infections, there is cellulitis, furuncle abscesses, wound infections, necrotizing soft tissue infections, etc. But here is a very important issue, that is fifth generation a correct term? Okay, we must know about this thing. Actually, the traditional classification of these cephalosporins was based on spectrum and activity. Earlier cephalosporins, that is from first to fourth generations, were categorized based on their activity shift from gram positive to gram negative organisms. But ceftaroline and ceftobiprole, these so-called fifth generation cephalosporins, show restored gram positive activity like MRSA and not a further shift to gram negative. Hence, they don't fit the classical trend of cephalosporin generations. So, some experts prefer to call them advanced generation or anti-MRSA cephalosporins because their main novelty is MRSA coverage and some activity against resistant gram-negative organisms also like Enterobacteriaceae. So, neither the US FDA nor European Medicines Agency strictly endorses the term fifth generation in regulatory classification. Then, where should they be placed? Actually, most accepted practical categorization is anti-MRSA cephalosporins or advanced generation cephalosporins, or simply kept after fourth generation as special agents. So friends, here you have to remember that even if your textbooks are mentioning them as fifth generation, but what is the reality? What is the most accepted practical categorization for this class? This is anti-MRSA cephalosporins or advanced generation cephalosporins. So always remember this very important point. So, okay, well, the next question is the drug used in the treatment of resistant gonorrhea is penicillin, cotrimoxazole, spectinomycin, or erythromycin. So, here the correct answer is spectinomycin. Yes, friends. Actually, the spectinomycin inhibits protein synthesis in bacteria by binding to 30S ribosomal subunit. It is primarily used to treat gonorrhea, particularly in the cases where other antibiotics are not suitable due to allergies or resistance, and it is given by IM route. So, friends, these were some important questions related to antimicrobial resistance, and soon I will be back with the new set of questions. For example, anti-pseudomonal antibiotics and clinical case based questions related to antibiotics. So, stay connected for maximum benefit and efficient learning. Thank you. Thanks.